Hi everyone! We all know that brushing and flossing are essential parts of our oral care, but flossing is often overlooked. So how important is flossing anyways? Flossing helps remove the plaque from the areas between the teeth that the toothbrush can't reach. It is important to remove the plaque because plaque contains millions of bacteria that feed on the food and drinks that we consume every day. These bacteria produce acids that attack the tooth enamel and damages the gums, causing tooth decay, gum disease, and tartar buildup. Flossing is recommended at least once a day, right before bed, and it's also beneficial after each meal as well. But did you know that there are different flossing aids that you can use? Here are some.
This is string floss. It is a soft thread used to clean between your teeth. It comes in waxed and non-waxed formulas and varies in thickness. Wax floss glides easily between your tight contacts, whereas a thicker floss is easier to use for open spaces. How to use. You gently insert the floss in between your teeth in a sawing motion to avoid damaging the gums. Hug the tooth in a C shape, slightly reaching underneath the gum and rubbing against the tooth up and down on each side. This is the most effective way to remove plaque.
This is a floss pick. This is a plastic tool with a U-shaped end that holds a piece of dental floss. They are used the same way as string floss, but just be careful when inserting the floss in between the teeth. Floss picks are easy to use, easier to hold, and can help reach hard to reach areas. However, this is not as effective as traditional string floss because it doesn't contour our teeth as well and can also damage your gums if inserted the wrong way in between the teeth.
Flossing brushes are interdental brushes. These have a small head with bristles made out of silicone or nylon. They're held together by a wire and usually has a plastic handle here. There are also soft picks, and these soft picks, they have a rubber or a silicone bristled head. There is no wire, as you can see there, and it has a plastic handle at the very end. These ones will vary in size so they can fit in between the teeth. How to use. Insert brush between teeth using an in and out motion, rubbing against the sides of the teeth.
To continue on from what Richard was talking about, interdental brushes or proxy brushes are great options for where you have any kind of open contact, you've got a crown or a bridge or any kind of ortho appliance like a lingual bar. The main thing we really want to stress is that these proxy brushes really should only be used in areas where you have the space for them. Meaning if you have any crowding, any kind of overlap of your teeth, you want to make sure you're not forcing them through because that can cause more damage to your gums. The other thing is if you have an implant, you want to be really careful because these do have metal wire inside of them here. You want to make sure that you're using what's called a soft pick instead, which is just all plastic because this little metal wire right here can scratch the implant. So a soft pick would be a safe option if you have an implant.
This is a rubber tip gum stimulator. It has a pointy rubber or silicone tip with a metal handle. It helps reduce plaque along the gum line and in between the teeth, especially areas with wider spaces. How to use. Run the tip under warm water to soften the tip. Gently place the tip between the teeth at a 45-degree angle using a gentle circular motion, and then rub along the gum line of the tooth, moving over to the next space. It can help reach the very far back surface of the last molar. This tool helps massage the gums, increasing blood circulation and aids in hard to reach areas. It also removes plaque along the gum line and in between the teeth. However, it does not help with tight contact areas.
I'm going to talk about water flosser. Water flosser is a pressurized water system that shoots a thin stream of water around the gum line in between the teeth to remove plaque, debris, and food. It comes in different model. One is countertop model and a cordless model. Now, how to use. Fill the reservoir with warm water. Select a tip and click into the handle. For starters, always start at the lowest pressure setting until you find a setting that works for you. Then lean over the sink and place the tip in your mouth. Turn the unit on. Close your lips enough to prevent splashing and let the water flow from mouth to sink. Aim tip at a 90-degree angle in between the teeth and move along the gum line. Remember to also do the inner surfaces. When finished, turn the unit off and remove the tip.
The water pick is easy to use and very effective in plaque and food debris removal, especially for those with braces, crowns, implants, and bridges, or just people who have a hard time using traditional string floss. It can reach hard areas such as wisdom teeth and the back molars. The only downside of the water pick is that it does take up some counter space, it can get messy, and it does take some getting used to in the beginning. However, we would still recommend using traditional string floss in those tighter areas.
Always remember that each product is not for everyone, as each individual is different. But we do hope that you did find some flossing aids that are suitable for your needs. If you have any questions or concerns, please reach out to your dental professionals.